It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my 84-year-old previously active father is on a ventilator and the dialysis machine in intensive care. Will his kidneys ever recover? You can check out last week's answer to last week's question if you're clicking on the link below this video. In this week's episode of Your Questions Answered, I answer another question from one of our readers, and the question this week is: my dad is in ICU after a subdural hematoma. He's had multiple surgeries and he's not waking up. Help. And this is part 1 of the question, because we will continue this question next week with part 2. Laura from Ireland writes: Hi Patrick, thanks for all the information you provide on your blog and through your emails. My dad is 64 and was admitted to hospital 6 weeks ago from today, on Friday the 21st of March. He had a subdural hematoma on his left and his right side, which required minor surgery of 4 burr holes to drain the fluids. However, the following day, Saturday, the fluid on the right side was running pink, so they knew the bleed was continuing, so they decided to make a bigger opening on the right side to take a better look. There were some surface tethered veins, which the surgeon corrected and replaced the bone as well. My dad was very uncomfortable and slurring on the Saturday night, and Sunday we knew something wasn't right. On Monday morning he was difficult to wake, and the ICU nurse spotted that his right pupil was much larger than the left. They decided to perform a craniotomy on the right side to relieve pressure and see what was happening. It turned out the bleed had reoccurred but was mopped up and the bone flap replaced. By the Wednesday, the pressure was not subsiding, so they decided to do a 4th surgery to extend the craniotomy and remove the bone flap completely. The neurosurgeon was happy with how all the operations went and explained he expected the midline shift that had occurred to correct itself now that there was a significant bone removal from the skull. My dad was then put in an induced coma. During this time they had some problems regulating his temperature, and he was making some jerking arm movements, which they treated with anti-seizure medication as a precaution. Although the neurosurgeon didn't think they were seizures, he also ended up having a chest infection which was treated with some very strong antibiotics. After 2 weeks, the neurosurgeon decided to take my dad out of the induced coma, as after all the problems my dad was now stable, but it was now 4 weeks later and my dad still hasn't woken up. All his vitals and other organs are absolutely perfect, and even though he has a tracheostomy to protect his airway, he's off the ventilator and breathing on his own. He had a CT scan and MRI, and neither show any reason why my dad isn't waking up, although there appears to be some swelling of the brain stem, which the neurosurgeon can't understand, as all the operations were surface brain and performed very quickly when each problem arose. Also, the correction of the midline shift is happening slower than expected. My dad's eyes are still closed, however we can see his blink behind his eyelids. He also responds to pain, although they are saying it's in a very primitive way. His heart rate and breathing changed when we are in the room. Even the head of the ICU acknowledged this, as the nurses had reported it to him. Our problem is that the head of the intensive care unit and a couple of the intensive care nurses are telling us that my dad has a very poor prognosis, and they are saying my dad may not wake up at all. As a family, we are remaining positive and spend each day in the hospital talking to Dad and putting on his favorite music and TV shows. We are all hoping Dad will be moved to a private room on a high dependency ward in the next week, once the hospital can figure out how to provide his care outside the ICU setting. We live in Ireland, where facilities are not very readily available for brain injury or brain trauma. I was looking for your advice on this case, as the hospital have never experienced 4 brain surgeries in less than 1 week, and they seem to be comparing my dad's case to people who have just had 1 surgery. The amount of surgeries would appear to be very traumatic in and of itself. Also, I was wondering if you have any advice on how we can further stimulate Dad in the hope that this will rouse him from the coma. They are saying the longer the coma continues, the less chance of recovery. Just another thing I forgot to mention, my dad's blood results came back this week, and it turns out he has factor 13 blood deficiency, which is very rare and explains why the bleed didn't stop after the surgeries. I'm sorry for the length of this email, however I wanted to give you a full picture of my dad's situation. I appreciate you taking the time to read this and would really like to hear your views. Many thanks, Laura. Hi Laura, thank you for your email. I'm really sorry for the situation that you, your family and your dad are in. It's a terrible situation to be in, and it's also very often a once-in-a-lifetime situation, and you want to seek the right type of advice in those situations. You have given me enough information so that I can shed some light on your situation. You see, Laura, the first thing that stands out for me is that your dad has had 4 surgeries on his brain in 1 week. That's massive, and you are pointing out correctly that the hospital would find it difficult to compare your dad's case to any other case, because they just have never experienced this before. I can tell you that even in big metropolitan intensive care units with big trauma intensive care units, they wouldn't see many patients having 4 brain surgeries in a month. So therefore, you are thinking in the right context, that your dad's situation appears to be exceptional given the number of brain surgeries he went through within a very short period of time. Therefore, it seems to be nothing unusual from my experience that the CT and MRI both show a normal brain after the surgery that shouldn't stop your father from waking up. You have also mentioned your dad's factor 13 blood deficiency. It's not quite clear to me whether this was known before admission to hospital or whether it was only diagnosed during his current hospital stay. Either way, your dad would have been at a higher risk for a bleed to occur at any given time with the factor 13 deficiency, and it would explain why the bleed reoccurred after the first surgery. However, with head and brain injuries, I have always seen some patients with reoccurrence of bleeding after surgery. Not a huge amount, but there are always some patients who rebleed. Normally, what happens in brain and head injuries is that patients don't have anticoagulation or blood thinning medicine after their surgery, which is different compared to other types of surgery, because those patients always get anticoagulation medicine to prevent deep vein thrombosis. However, in head and brain injuries, normally no anticoagulation medicine is given, due to the fact that the risk of a bleed in the brain needs to be avoided at any cost. Normally, an induced coma after head or brain injuries is done to protect the brain and to give the brain time to recover, and especially with a midline shift, the induced coma is also buying time for a midline shift to resolve. You didn't mention any abnormalities in the latest CT or MRI scans, therefore your dad should wake up, according to those pictures. However, this is what happens right across the board with head or brain injuries, that CTs or MRIs look normal and patients still don't wake up. And here lies the crux of the issue. And I can tell you that in more than 15 years of intensive care nursing in 3 different countries, the biggest difference in some patients waking up and others who don't is time. Imagine a brain that has been operated on 4 times in less than 1 week and has undergone massive trauma, and it therefore takes time. I can tell you that the biggest difference I have seen in patients who recover from severe head and brain injuries are the ones who are given time, patience and nurturing. Once out of intensive care, special rehabilitation for brain injuries might be next. It also doesn't surprise me that the head of the ICU and even some of the nurses paint a doom and gloom picture. The head of the ICU, even though he won't admit it, wants the ICU bed available because, especially if your dad has been in ICU for 6 weeks now, they are counting the numbers. You should ask the intensive care team how long they would expect it takes for your dad to wake up, and you should ask how long they are prepared to look after him. I have worked in some ICUs where we had head or brain injuries for months, and we nursed them with patience, and from my perspective it made all the difference. Patients recovered. It took a long time, yes, but with ongoing stimulation, patience, nurturing, positivity and a strong belief that it's doable. Those intensive care units had a vastly different philosophy and culture compared to other intensive care units that I worked in. It's not the ultimate recipe for a successful recovery, but it tends to have all the ingredients. Some other intensive care units that I worked in had a very negative culture about head and brain injuries, and when the earliest sign appeared that a patient may not wake up, the intensive care teams have been very quick in painting a doom and gloom picture, because they simply don't want to spend the time, the energy and the resources that it takes to get patients and their families through this difficult and emotional roller coaster. Those intensive care teams tend to be very good at quote-unquote selling a withdrawal of treatment and or a limitation of treatment as being quote-unquote in the best interest of their critically ill loved one to the families of those patients. It's also often not perceived as sexy by the intensive care team to continue treating patients that don't require the latest technology or where they can't do the latest medical research and so on. I have also included 2 links to 2 related articles in the written version below this video. One related article is what the doctors and the nurses' behavior in intensive care is telling you about the culture in a unit. And the second article that I linked towards is it sexy for the intensive care team to treat your loved one who requires a long-term stay in intensive care? Check out those articles by clicking on the links below this video. Something else, Laura, that I can see is the difference in the perception from the neurosurgeon and the intensive care team. Generally speaking, the neurosurgeon would never tell you that the surgery performed would be unsuccessful. And the neurosurgery team would probably like to have your dad in intensive care for a long time to come until he can recover. However, they also know about the resource constraints and the pressures in intensive care for beds. Therefore, there often is a difference in perception about prognosis from the intensive care teams and from the neurosurgeon's perspective. If you have read my instant impact report, you would have discovered the difference in perception from different medical teams in the report. Furthermore, and that's another big takeaway from my perspective, even though CTs and MRIs are giving us a lot more insights about the brain nowadays, even the neurosurgeons or the neurologists don't know enough about the brain, and therefore their prognosis remains vague as well. The brain has a life on its own, and I really think that time will be the answer to your and your dad's dilemma. You are also asking what you can do to stimulate your dad further. Some simple but practical steps here. Make sure your dad has good nursing care with a routine such as brushing teeth regularly, having regular showers and a good night's sleep. Make sure your dad gets mobilized and out of bed regularly, at least twice a day. Also, make sure that your dad is in a room with some natural daylight. Make sure your dad is getting outside of intensive care, in a park, getting some sunlight. Make sure that's happening. Also make sure that your dad is being looked after by regular and experienced nursing staff. The reality is that many intensive care units tend to send less experienced or even agency nurses to look after the long-term patients. And you should be making sure that there's regular staff that works within the unit looking after your dad so that he can get the best care possible at all. Those things need to occur regularly though, and you may have to keep asking for those things if they are not happening. Don't take no for an answer. Also, has a neurologist been involved in order to do further testing, such as performing an EEG? An EEG can determine brain activity and can also shed more light on future prognosis. Also, have you thought about getting your dad home? I don't know the situation in Ireland. However, for example, in countries like Australia, Germany, Austria, Switzerland and in the United States, intensive home care nursing is a real option for patients with tracheostomy, and being in a home care environment usually makes all the difference. You can check out intensivecareathome.com.au for more information. I have personally worked in the community with tracheostomy and ventilated patients as well, and I believe it's the best option. However, it depends on service availability, of course. Home care is often a win-win situation because patients and families are in an environment where they want to be, and it tends to be more cost effective and it frees up the much needed intensive care bed. Finally, Laura, listen to your gut feeling. Irrespective of what the intensive care team and the neurosurgeons are telling you, what do you and your family deep down think is going to happen? What do you and your family deep down know about your dad? Will he recover or will he not recover? Families of critically ill patients often get caught up by the intensive care team's expert opinion, and in the process they forget one of their deepest sources of wisdom, which is their gut feeling and the knowledge they have about their loved one. Because if you give too much weight to the intensive care team's expert opinion, you would have given away your level of power, control, influence and peace of mind straight away. I hope this helps, Laura, and please let me know if you have any other questions. I really wish you all the best, strength, faith and good luck in your challenging situation. How can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care. And how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section with more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.